It is changing. As we see, and we have talked about that, there is the health issue, there is the economic issue, there is the livelihood issue, there is the transportation issue. There's a whole lot of issues. And there are changes taking place all over, everywhere. We don't travel the way we used to travel. Now we have to maintain distance. And in our trains, now there is one in 2 seats. You have to keep 1 seat vacant. And even that is, I don't know, is appropriate or not. Similarly in buses and others. But in many countries, including Bangladesh, people don't listen to that. They do whatever they want to do. They mix, they travel together. They don't wear masks many a time. It's not only in Bangladesh, but even in developed countries. They go to beaches whenever they get a little bit of a chance. That happened in Australia. So we are getting waves after waves after waves in many countries, several waves in the European countries. There are second, and in some cases, third wave is there. In Bangladesh, we are still in the first wave, and we don't know exactly where we are. Our situation is. One day, we see a little bit better results in terms of testing and that. The next day, it's worse. So we don't know how long it's going to be like this, and when we'll actually start containing this pandemic. At the same time, you can't lock down for a very long time. Otherwise, there is the other security, economic security, livelihood security in particular, of the poorer people, poorer segments of population. And that's happening all over the world. Even in the United States, the poorer segments of the population, they are suffering the most. So you can't keep the economy shut for a long time, therefore you have to open it. And then if you open the economy, people must behave health-wise. There are advisories provided by the World Health Organization as well as by the health departments of the countries concerned and others. In our case, our Prime Minister herself has been giving advisories, not only by the health ministry and others. But if you look at the TV, I don't go out. I'm advised not to go out because I have other complications apart from being very old man. So I don't go out. I don't see outside what's happening. But on the TV, I can see people are mixing and they are not listening. And that is also the same in India. So what's going to be new normal? Are we going to go back to the way we mix people, mix with other people? We socialize? Maybe not. In the new normal, that probably will be suicidal in many cases. And therefore, we have to find a way. And people must get used to it. And our Mexican friend used one word again and again and again, attitude. Attitudinal change is extremely important. We have to adjust our attitudes to the new circumstances. That will bring us new normal. Otherwise, if we don't change our attitudes, we will not get any new normal. We will be in the same old mode of operation and behavior pattern, and therefore the pandemic will come back again and again and again, even if we get the vaccine. Now, doctors are telling us even if we get the vaccine, it will last for 2 years. We know Spanish flu lasts for 2 years, and Asian flu lasts for 2 years, 2.5 years. This one nobody knows. And this is the worst in terms of coverage of the whole world. The others were severe, deaths were probably much more, but They were concentrated in certain areas, not throughout the world. And therefore, the business around the whole world was not shut up. But today, traveling is shut up, and business is suffering all around. Now, from there, how do we move forward? In Bangladesh, we have opened up the economy, and we are advising people to behave health-wise. But as I earlier said, they don't. And yet, we have to do it. However, in Bangladesh, there are 2 or 3 good signs. For example, the remittances increased. It was record ever last month, highest ever record on remittances. Export also increased substantially last month. And rural business is also taking off. If we can contain the pandemic, I think we can recover fairly quickly. But then we have to change our attitude and behavioral patterns. Economics, we start by saying that economics is the study of human behavior between ends and means which have alternative uses. That means that we are dealing with human beings in economics. But actually we are not. These days, neoclassical economics, we are dealing with numbers, percentages of people. But mostly we are dealing with capital. It's a capitalist society. So one of the things I thought, and I wrote, that there will be change in the behavior pattern of people after this COVID pandemic, because this has leveled people. It doesn't care whether someone is a minister or a beggar, someone is a king or a prince or a lowly person. It attacks anybody and everybody. So I thought from there that human beings are equal as human beings. They have the same set of rights to be achieved and same human dignity that should aim for, and they should get that. But I was bewildered. I find that under these circumstances, nobody knows when one will be attacked. People are not behaving the way they should. They are behaving just like the old. They are trying to make money out of the misery of the people who are suffering the most. Not only in Bangladesh, it's around the world, everywhere. So after COVID is over, let's say 2 years, or 1 year, or 3 years, or whatever, I suspect that the same neoliberal behavior pattern of the rich will come, perhaps with a vengeance, because they have lost some, they want to recover that. And therefore, they will probably become more aggressive in order to amass wealth and control more technology. And we are getting this robot and robotic apparatus and things like that. Few people will control those technologies, and therefore the others will remain outside the progress that will take place after COVID. That's one scenario. But first scenario, I said that we will be human beings and we will care for others. I will care for you, you will care for me. In other words, this African philosophy, I am because we are. That's an African philosophy. I think this is something, if we can take in. What we do is, I am because I am. I don't care about it. Are we going on that path? So some of us, those who are concerned and those who are talking about these issues and working on these issues, should probably try and see if we can make some messages out that this is not the last pandemic the world has seen. There may be more pandemics. And it's very likely doctors are telling us that there are more. This particular pandemic was predicted before. We had SARS, MARS, and there was the doctors and the scientists were predicting that some another one is coming. Nobody cared because people were concerned with making more money and more technology, controlling more technology, and so on. So if we learn now, and I'm not very sure if we will, then probably this world might become a world of human beings who are equal as human beings. They will not be same. They will not be at the same level of wealth. They will not be wealthy. Everybody at the same level, or they will not have. Everybody will not have the same power. Everybody will not have the same post position in society, in the government, in the hierarchy. But as human beings, wherever one works, one will be a dignified individual. One will live in a dignified manner, dignified human being. So that should be our new normal. New normal, I think, if we can get there, but I suspect we will not. But let us work and see that in the new normal, can we bring human and social values, which we have lost, so that people care for others, altruism, we give some, we help others. In altruism is that you just don't care for yourself, you care for others. And there are some who talk about earn more. If you need $100, earn $200 and give away $100. That kind of things have been talked about. But there are some others also, like Bill Gates. They have amassed a lot of money and they are now giving out. And I was just reading an article today and I found out that Bill Gates is giving, say, 10 billion, but he is getting back every year more than 10 billion. So he's giving and becoming richer almost every day. So that's not what he should have given half of it or more of what he has. He doesn't need all those billions, does he? So even there, it's philanthropic and yet not so much philanthropic. So if that article is true, that he is making more money every day than he is giving out. And that applies to Bezos and the others, Zuckerberg and so on, the global rich people. Maybe even in India, Ambani. Tata is a bit different, as I know. I have read about that. But there are not many Tatas around. In Bangladesh, it's very early situation yet to be philanthropic, but there are some still who have started doing it on a small scale. I hope that will grow in time. But here, the neoliberal hold is very, very tight in Bangladesh. Also in India, also in other countries. Neoliberal hold meaning those who have, they have the opportunity of getting more and more because they can control not only the economy, but also the politics. They join politics, they become policymakers, they become policy implementers, and they are the beneficiaries. So beneficiaries, policymakers, policy implementers, the same person. What happened to the common people? So your new norm is going to be something that I had expected, and I wrote about that, but I wrote another article saying that it may not happen. But if you have ideas on this, how the new normal should be shaped. Now, on the business, I'll say a few words and then I'll close. In Bangladesh, for example, in rural areas in particular, and also in urban areas, in the informal sector, most of the businesses were shut down. And we have about micro enterprise, about 1 crore in Bangladesh. almost all of them were non-operational. And therefore, all these people, about 3 crore people who are involved in these activities, their livelihoods were at stake. And the government came in, provided assistance, livelihood assistance, and also some of our institutions, industrial institutions, as well as wealthy people came forward and they helped. And some NGOs also came forward. So together, government and private sector, civil society, together, we have been able to help people out. Some, of course, have been left out. They didn't get quite the assistance that they need, but at least in most cases, we have been able to help them survive. Now the question is to get back. Now there was a level of poverty in Bangladesh, about 20%. Now people are estimating that it might be 30%, 35%, or even 40% now, maybe double. So my position is now very clear. I want to see the new world. We're talking about new normal. New poor must get back to their original position as soon as possible. And as chairman of Public Commercial Hire Foundation, I have a responsibility also. We have a huge budget. The last board meeting, and I have another coming up on 26th, we are providing from our own resources. Government is also providing some resources. It's a government sector organization. A huge amount of money we are providing, putting into the rural economy. About 350,000 crore Dhaka we will be putting in within the next few months. And we work with 1 crore 40 lakh households. So we will reach them hopefully within the next 2-3 months so that they can rebound. And my concern is those who become newly poor, they should get back. And we should not forget also those who were poor before. And there were at least out of these, half of the, about 20%, half of them extremely poor. So we must work on those aspects, but those who are newly poor, they should get back. And the two things: one, economy will move forward because our economy achieved over 8% growth rate, and I have always said that it is because our rural economy, not only agriculture but also non-agriculture, was vibrant. We were able to achieve that. The basic circumstances were right, and that's why we were able to achieve that kind of growth. Of course, a contribution of government, contribution of other sectors are there, but you need the plinth. If you want to build a building, you need a good plinth. So plinth was right, and now if we can get these people back to work, and your supply chain and demand, everything. Unfortunately, there's something happened here. Supply was disrupted, demand was not there. Both came together. Bangladesh, one other thing, our growth was domestic demand driven to a large extent, and that has declined. Now I hope, because foreign remittance has come quite a bit this month. I don't know about next month what will happen next. And if we can get these activities started soon, I think this demand will be created, and then we can move forward. Circumstances vary from country to country. Broadly, it's the same. There's this COVID. It has affected health and livelihood and the economy, as well as security and transportation everywhere. But because of the circumstances, the approaches to overcome the problems may differ in certain respects. and each country has to identify those and work on those. In Bangladesh, we have been trying to do it, and our Prime Minister on 13th April declared a package of assistance and support to the industries and small and large industries, export-oriented industries, small industries, medium industries, micro industries, and so on. But the unfortunate thing is, still, these are not implemented. Most of them. Some of them have been implemented, the others are not. So there's a policy is there, the program is there, funding is there, but then it's not reaching the people it should. So there is one problem. Therefore, if we want to get back to normal, some kind of another normal, where everybody has to put in their efforts with due diligence and commitment and honesty. So honesty is a word very difficult to find today with people. Honesty, probably we have forgotten about this word. And many may have deleted it from their dictionary. Being honest is not good. If you want to rise, you have to be dishonest. And you should not keep your commitment. You should not look to others. You should look inside to yourself. And in countries also, inward-looking, like in the US, inward-looking attitude is going to be harmful to the global economy. So we have global economy problems, we have national economy problems, we have local economy problems, we have problems with people at various stratum of the society, particularly those who are at the bottom. And in the recovery program, in Bangladesh at least, we talk about the poorest of poor. The focus is on them. It remains to be seen whether the programs which have been designed and the allotments that have been made will be implemented properly to reach those people, or it gets siphoned off somewhere along the way. Otherwise, we will not. If it does not get there, we will not get the recovery we want. And then your supply and management and all these chains and channels cannot remain chained unless assistance is available to the people who need them and at the time and in the scale that is necessary. If someone needs, say, $10, give them 50 cents, they will not be able to get back to where they want to get back. So these are issues being discussed all around, and I have participated in it. And as I said, I have a responsibility. So almost on a daily basis, I talk to people in rural areas. Of course, not personally. I used to do that personally. I used to visit rural areas, but now I can't do that personally. But I talk over this internet and so on, almost on a daily basis. For example, we did that day before yesterday. We'll do it again tomorrow. And almost every day, segments of population. And then we try to involve everybody so that we can achieve the goals that we set ourselves. So I thank you very much. Thank all of you for your contributions. And Mahbub has promised us whatever we have said, we will put into the paper, and in some day, in the future, or in the past, I don't know, it will come out in a book form so that we can see what we have said. Are they consistent? Are they meaningful? Or are they going to be helpful in relation to policy making or policy changes? We have many policies. We need to change policies now. We need to change attitudes now. We need to change behavioral pattern now. I started with the definition of economics. So that behavior of people, of the economists and others, that's extremely important. And behavior has to be not only in relation to capital, it has to be in relation to humanity and social social capital is more important than physical capital. So social capital and humanity as well. That's what it should be. So I thank you very much. Maybe I have talked much too much, but this is a subject I've been working on for quite some time and have been writing on. So I get sidetracked when I start talking about it. So I may have bored you, but you have listened to me. So that's why I thank you very much. Let us all work together from our own vantage points to see that the society moves forward. Not the ones who are richer, they can take care of themselves, even if there is independence that lasts for another 2 years or 3 years. But those who cannot, let's look to see how we can help them so that we have a society which is composed of all human beings living in dignified human manner. Thank you very much.
Thank you, sir, for your excellent presentation. I would like to open the question and answer session. Anyone ask any question to our dignitaries? Please feel free to ask the question. Anyone?
So, just can I start?
Yes.
Yeah. So you have just said that we are lacking the spirit of what you call the virtue of honesty. We are all waiting for vaccine. COVID-19 vaccine is required to protect ourselves physically, that the germs or the virus is not inflicted in our body. So, sir, my question is, humble question is that how and when we'll be able to inject the virtue of honesty in the fabrics of our mind, in our mindset? Because this is most important, you said. So vaccine is not going to solve all our problems, COVID-19, unless and until we can change the fabrics of our mind with the virtue of honesty and integrity. Thank you, sir.
Thank you. To whom you ask the question?
This is not a question, this is a statement. All agreed. Nobody would disagree.
Okay, sir. Irene ma'am, will you ask any question? Irene ma'am, Dr. Irene Akhtar ma'am, will you ask any question?
No, thank you. From very beginning, I'm here. I'm enjoying every speech, though it is not my area. It is area of supply chain. But one paper is from my area, that is HR. I enjoyed that paper from HR. One paper was there. And there are some papers from the entrepreneur. The main thing is that what we are learning every day, the new word I have learned from Sir Koliki Jaman sir, that is new poor situation. So these are the words. Every day we are experiencing some new words. So thank you, everyone. That is the great initiative which is taken by you and your team and your institution. Okay, thank you.
Thank you, ma'am. Actually, I am lucky enough that our students are so active with our colleagues that, and under the able leadership of our Kolkata Mohammed sir, we can arrange this sort of international conferences. And these conferences become meaningful when all of you join. So, any other question from our colleagues
or comment?
Comment, please.
Comment.
Sarah madam, Sarah madam and Dr. Ashujan, do you have any comment? Dr. Ashujan, do you have any comment from India? And Sarah madam.
Final word of wisdom. Okay, it seems that there are none. So
Dr. Sarwan, yes, Dr. Asuddin. Yes, speak.
Yeah. Only thing is, sir, that it was really a very wonderful experience for all of us. We have got a very exposure through your online efforts and the hard work. And I'm grateful to each one of you for being there with us. And Professor Kazi, your keynote address was really wonderful, and we got to know what exactly Bangladesh is doing and how you people are facing and accepting the challenge, and then now reopening your this country with new hope and new wisdom, new knowledge. So we congratulate you, and I hope that we'll have a mutual beneficial relationship even after this webinar. A very strong effort and steps have been taken by Mr. Dr. Mahmood, and I congratulate the entire team of Professor Mahmood for giving this opportunity to everybody. I'm thankful to you also. It was indeed a privilege for us to be there with you all. Thank you so much.
Thank you. I am also grateful to Aman. Without
Dr. Mahmood, can I speak?
Yes. Speak, madam.
I'm Dr. Swati. Dr. Swati Basu Ghosh from Bangalore. I'm a faculty member in Ramaiah Institute of Management. So I found out from mail that it's happening, and so today I clicked on this link, and really wonderful session. And on a small screen, I can almost see whole world. It's a very good initiative. I really congratulate you and your team. And we could hear a lot of actually, which I didn't know also, especially about Bangladesh, a lot of information because I work also in this area. And as I didn't get any information earlier, so I couldn't send any paper, but I'll be happy to be in touch with all of you. And it's really good initiative. Good luck to all of you.
Okay, I'll ask Mahbub to establish a Google group or some kind of group so that we are connected.
Okay.
That will be wonderful. That will be wonderful.
That we much appreciated, sir.
We do have a Facebook. You can join there.
No, this particular group.
Okay, sir. We shall do it.
Thank you.
Yes. Anujay, what is
I would like to say hello to our friend that we met last time, Dr. Yashoda Dulge. And I think I communicated with Miss Professor Sarah Nasneen before, by email maybe, right? Remember? Thank you for Dr.
Hello, Professor. It's lovely to be here, and thank you for remembering.
Thank you. Yes, I remember very much. And thanks to Dhaka School of Economics, and wish you all the best and all the participants. It's great. Thank you. And Malu, please say my hello and thanks to your previous students.
Okay, they are also here. They are also here.
I saw Anis Khan.
Yeah. He was today speaker in the technical session too.
Oh, I see. Okay. So he was not okay.
He was excellent speaker. He discussed nicely.
Okay.
Any other comment, or we have to finish? Before that, we want to thank our friend from Mexico, Dr. Joseph. Yes.
Thank you very much. I genuinely appreciate.
Hello.
And I apologize for all these technical matters. And I would let you know that we are very receptive to exchange. My university's Center for Economic and Managerial Sciences, we have students from 73 nations actually. So it's very highly dependent on the public organizations. Organization is in the ranking all of Mexican universities. So you are very welcome if you come to Mexico, and I this is a good opportunity, to introduce myself to you and to be in touch with you. We are going to be in touch. So thank you very much.
Thank you. Okay.
Yeah, hello, Mahbub, hello.
Thank you very much. Electricity, please. Hello.
Yeah, hello, Mahbub. Yes, Darryl Macy here. Yeah, hello, I enjoyed your talk, Dr. Kwazi, very much, and everyone's contributions.
Yes.
I wondered, when would you like me to give the remarks? You said, is it now a good time?
Yes. Quick remark.
The special guest remarks?
Yes, please, quickly.
Yes. Actually,
I've been here since the beginning. I was just waiting for according to the program.
I have written several times.
Who is Mahbub?
Hello, I'm Darryl Mesa. Yeah, hello.
I write about 10 times. Yeah. Yes. But I've written several times that. Okay, please tell. Because I thought you did not join.
Please give.
Problem. I asked inbox.
Okay.
Darling. Yes. Are you Professor?
Hello, yes, it's Darryl Mesa here. I was in the...
Yes, you were supposed... I was looking for you. Yeah, please, go ahead.
Okay, please.
Yeah, thank you.
Go ahead.
No, you missed him out. Please go ahead.
Yeah, okay,
I was
hello.
looking at the name, but I was not hearing you.
Okay, so I hope everyone, you can hear now. I'll share my screen. I wanted to talk about the World Emergency COVID-19 Pandemic Ethics Committee. We've established, this is a website I've also put in the chat. And we've, so far, it's a committee of 40 members from 40 different countries around the world. It's a non-government committee we established at the time of the COVID pandemic. And you can see on this website the statements that have emerged from different working groups. So we have people from many different countries, including Dr. Anwar Hassan from the Public Health Association in Bangladesh. And we've tried to look at, so these are the members on the screen, you can refer to in the website. We've published about 70 papers on the COVID-19. We have the next conference coming in 2 weeks' time. Everyone is welcome. We have about 4 or 5 active participants from Bangladesh. The terms of reference of this committee, the World Emergency COVID-19 Pandemic Ethics Committee is a multidisciplinary group of persons from a variety of professional backgrounds who are cross-cultural and global background, independent of government, living in different conditions in different countries during the same COVID-19 crisis. So with some advantages, I used to work for 10 years as UNESCO regional advisor. There's sometimes an advantage to be an independent forum because we may be able to reflect more actively on some of the policies that governments and researchers make, which may be sometimes unethical. We look at the interface between theory and practice of ethics around the world. We compile and produce reports. And there are different working groups that have been established And some of you may be interested, and in particular, today's theme is very much linked to this working group we have on ethical values and principles for a new world order. I briefly also, I just do flash the on the screen the statements. So one statement is on the call to cease the use of war metaphors. Fighting a virus or combating a virus is different to fighting a war. We're actually trying to act together in solidarity in the world. The first statement was on the public use of masks. I'm very pleased that in most countries in the world and the World Health Organization now recommend to wear masks, but actually in March and April, they failed to insist on wearing masks, and tens of thousands of people, maybe hundreds of thousands of people died because of this hesitance to insist that people wear masks. By the way, I would not expect a vaccine for another 6 to 12 months. So as a molecular biologist, I don't think it's going to be coming. So we need to be prepared for living under these conditions for some time. We had a statement on ethical triage, guidelines, how do hospitals allocate resources. I think this is a very big issue everywhere, not only in the United States or Bangladesh or India or China, but actually every country in the world. And another was a statement which we've agreed was the state and governance, and that's the latest statement. Excuse me. We have 10 recommendations you can download on the website for the obligations and recommendations for states as institutions of effective leadership, and recommendations are made in that type of format. And a statement on individual responsibility and social responsibility. So we have about 12 groups working on different aspects of the implications of pandemic to people. And I think the advantage here of this forum as an independent forum is quite critical. Sometimes, as many of you working on government panels or UN panels will understand, we can't always say exactly what we'd like. But here we're trying to bring together people of a wide range of worldviews and perspectives to share together and try and learn together. And I think what's very critical is we document. So all these, the webinar, all the presentations and conferences that all of us are organizing contribute to a great deal of knowledge of how we can proceed and the lessons that we'll learn. And again, this is something which will be with us for the coming 1 or 2 years as we adapt to it. So I think we've had to adapt. We can't really relax. The virus takes no holidays, even though people get very tired of these physical distancing measures and the new systems of communication. So that's what I wanted to share. Thank you very much, and I enjoyed everyone's papers. Will it be a wake-up call, I hope, maybe, for the environment or economics, or the way that we relate to each other as fellow living beings? I hope that it does. Thank you, and encourage you all for sharing your research. These issues I found so familiar, whether it be in Dhaka or in Durban or in Los Angeles or in London or New Zealand, where my home country is. These are all issues that we face as we're living in different places. Thank you.
Okay, so
is it open?
Let me thank you very much, and let me apologize because somehow Mahbub didn't see you where you're not there. But
that's okay. Yeah, I know
but
Mahbub well.
it's good that you have been able to speak. I had the list, and I was looking at the list and finding one person missing, not speaking, but that was you. So now it's all complete. Thank you very much indeed. Okay.
Thank you.
So we close?
Yeah, I think
Okay.
we lost Mahbub. It's okay.
Until next time. Now you have given us very useful information. At least I am very interested, particularly the ethics and so on, because this is one of the areas I am particularly concerned: morality, ethics, human values, and so on. So I'll look up your website and see. So Mahbub, shall we conclude?
I think he lost his connection. I saw him.
Okay, he lost. Sarah, let us conclude.
So can you send your invitation to us about your next conference on ethics that you are going?
Surely, we'll first set up a Google or WhatsApp group, and then we'll discuss among ourselves and decide on the time and topic. I think that is better, rather than we deciding the time and topic ourselves only. So the topic which will be most relevant for all of us. You know, there are topics, some topics. Today's topic is relevant topics are relevant for everybody, but it's so wide. It's very difficult to concretize some of the things. So we will do very soon. We'll be around and then decide on the topic and so on. Okay, so let's conclude. Somehow Mahbub got disconnected, so we thank him and his team, Sarah and তুমি আজকে এখানে কি রাইয়া কোথায় রেহানা কোথায়
Sir.
Mahbub and his team in Dhaka School of Economics, other colleagues. So I thank all of you for this, and I thank all the friends from all around the world. So we can't travel, for example, to Mexico or perhaps wherever you are, but we can come together through this mechanism. I think it's an improvement. This may be one of the new elements of new norms that will not spend traveling time. If I go to New York, it will take 2 days. So I can sit down here and discuss if someone is in New York or maybe in Sydney. So that may be part of the new normal. So thank you then. Bye.
Thank you. Bye.
Okay, bye-bye. Bye. Thank you.
Thank you.
Okay. Thank you all.
Bye-bye. Thank you.
Thank you all.
Thank you all to join with us.
Thank you, everybody. Thank you.
Time.
It is better to develop a Yahoo group mail. Okay. We'll share
Thank
it.
Electricity crisis. Electricity went and some networking problems faced by sir. So thank you again. Thank you.
Thank you, madam. Thank you, madam. Thank you, madam. Thank you, madam.
Thank you all.